This is an urgent 5-minute fix. I'm Alex Garrett here, and it is actually my 50th 5-minute fix. And I've been wondering what I was going to talk about for the 50th episode of this little feature, if you will, of Alex Garrett podcasting. And I found it. I have found it. Because if you're a guy over 50, you want to know this story. You absolutely want to know this story. Because it involves your prostate. And here's the buildup, okay? You know, the author of the study at Indy 100, Greg Evans, says this. Says, in a sensitive but important issue for men around the world, the gland which produces semen is obviously very important. But disorders in the area are increasingly common amongst men over 50. And a large prostate can, of course, lead to urination, prostate cancer, which is now the third most common cancer in American males, by the way. I did not know that, but it is. He says diet, exercise, regular checkups are the most effective way to keep your prostate healthy. However, there's a new, much more enjoyable method which has been discovered by Harvard. Now, I guess Harvard's got some horny nerds up there or something, I don't know, because here's how they decided to help men over 50 figure out how to avoid prostate cancer. They surveyed the sexual habits of 32,000 men, and in conclusion, determined that those with a higher rate of, ejaculation were less likely to have prostate tumors. So this is a very interesting topic for myself because, if I'm honest with you, sometimes I wonder with all the UTIs I've had, if I'll ever be able to have kids. And we're going to actually talk to a urologist next week, so that should be interesting. But the author of this study from European Urology said, we have found men reporting higher compared to lower ejaculatory frequency in adulthood were less subsequently diagnosed with prostate cancer. So basically, if you ejaculate, jerk off, for 21 times a month, they say, you'll be fine. Fascinating, and here's why I find this study even more fascinating, which you would find. How did they survey all of this? Did they watch people have sex? Were they on porn sets? Like, how did they measure this? What kind of lab did they use to figure out that men over 50 specifically should be ejaculating 21 times a month? Science is hilarious. But it is true to have a healthy sexual health. It is true that to release like that is very important. But so many questions. So many questions about the abstract that they discovered. So many questions about how they got this done. EuropeanUrology.com. I'll cite the actual study as well. By the way, I guess doing some Invite Health Radio on AM 970 The Answer has inspired me to get some health in my inbox here, but they've done this for over a decade of even follow-up. To incorporate an additional 10-year of follow-up into an original analysis and to comprehensively evaluate the association between ejaculation frequencies and prostate cancer, accounting for screening, clinically relevant disease subgroups, and the impact of mortality from other. Here we go. The health professionals' follow-up study utilizing self-reporting included 31,925 men who answered questions. Okay, so they didn't really see them in action, but they asked them about their action. Who answered questions on ejaculation frequency on a 1992, this is 30 years old, questionnaire, this started 30 years ago, and followed through to 2010. The average monthly ejaculation was assessed at 3 points: age 20 to 29, age 40 to 49, and the year before questionnaire distribution. During 480,831 person years, 3,839 men were diagnosed with prostate cancer. The frequency at age 40 to 49 was positively associated with age-standardized body mass index, physical activity, history of sexually transmitted infections, consumption of calories, alcohol. The prostate-specific antigen test utilization by 2008, number of PSA tests, and frequency of prostate biopsy were similar across. It's just fascinating what science is. They even include in their study, Global Burden of Cancer in 2008, a systematic study analysis of disability-adjusted life years in 12 world regions. I have to see that, and I'll follow up with that. But yes, if you're someone over 50, hell, if you're anybody, right? I mean, 21 times a month is a lot, but it's pretty reasonable. My friend just texted, he'd be asleep for a week. Now that's freaking hilarious. But, yeah. I don't even know how to encourage this, but, get some action is what I'd say. Summer's winding down. Have some fun. Maybe it'll help you fix your prostate and keep your prostate healthy. And as someone who catheterizes also, I am on alert about this stuff because I do want to perform well. I'm not going to lie about that. And it is an insecurity. I'm not going to lie about that either. I mean, it's been, it's not been impossible, but I know I can't wait to talk to my urologist about this and figure out with someone who's had so many UTIs, a very complicated body, if this is beneficial to me as well. We'll let you know. I'm Alex Garrett. Jerk off a little bit. 21 times a month, they say. And maybe you'll feel a little better in this world that's coming back at a fast pace, despite all the craziness around it. I'm Alex Garrett. That is your 5-minute fix in 8 minutes or so. Take care.